What's going on here? Who are you? I'm the posture police, okay, buddy? And I'm writing you up for forward head posture, rounded shoulders, and thoracic kyphosis. You're looking at least 3 months, buddy. But enough of the toot, okay? Or I'm gonna give you 2 more. Okay, what am I being charged for? You're in violation of Section P, Paragraph 7, which states that sitting in a certain posture for a certain amount of time will certainly cause pain. Alright, but I'm pretty sure that latest evidence shows that... Listen, I don't want to hear this latest evidence. Hold on a second.
We've got a male on foot with excessive lumbar lordosis.
Jesus, excessive lumbar lordosis? I gotta go.
Does having bad posture cause pain? This is a long debated topic between physical therapists, physicians, chiropractors, and other healthcare practitioners. And while all disciplines may not agree on a single answer, I think there are a lot of myths surrounding the posture and pain paradigm. And with so much content out there on the internet, it's hard to decide what's true and what's actually expert opinion. But before exploring common stereotypes about posture, let's define what posture actually is. Posture is the position in which someone holds their body when sitting or standing. Now, we can all agree, this is a pretty common and accepted definition of posture, but it's a little outdated. What posture actually is not a position, but a dynamic pattern of reflexes, habits, and adaptive responses to anything that resists you being more or less upright and functional. Some examples of this include gravity, working conditions, and your anatomy. When we talk about posture, we usually talk about good versus bad posture. But what do we base this off of? Why are some postures more correct than others? Correct posture is thought of having all 3 major curves of the spine present and aligned. This includes a cervical lordosis, a thoracic kyphosis, and a lumbar lordosis. Practitioners in favor of neutral alignment often criticize shoulder positioning too, stating that you shouldn't be rounding your shoulders or protracting your scapula forward, as this will place excessive stress on the joint and eventually increase your risk of developing shoulder pain. At this point, you're probably saying to yourself, well, yeah, Matt, rounding your shoulders forward and sticking your neck out is obviously going to cause pain. If you stop for a second and look at the way that you're sitting or standing right now, I'd be willing to bet that you're probably not sitting with correct posture. But I'd also be willing to bet that you probably don't have pain either. So how do you explain that? The reality is, everyone's anatomy is different, and we assume certain positions and postures throughout the day according to our individual tasks. Hardly do we ever sit or stand with correct posture, and if we do, it's usually because we become aware of the way we're sitting or standing due to preconceived notions about posture causing pain. When I first started asking everybody's thoughts on posture, mostly everyone agreed that it's not only linked to pain, but it's a direct cause. But what does current research say about the relationship between posture and pain? A 2006 article by Grobe et al. Studied sagittal plane x-rays of 170 volunteers' cervical spines. They also had subjects fill out a questionnaire related to their neck pain, if pain was present at the times the x-rays were taken. Subjects were then divided into 2 groups, one with pain and one without. In conclusion, Grobe and colleagues determined that there was no association between cervical spine curvature and the presence of neck pain. In 2014, Dr. Adam Rufa published a narrative review that included 31 articles looking at scapular, cervical spine, and thoracic spine resting postures and their impact on the development of subacromial impingement syndrome, or shoulder pain. Out of the 31 articles selected that met the inclusion criteria, 9 looked specifically at the resting posture in subjects with shoulder pain. All 9 of these studies found no correlation between static posture and shoulder pain. As for the rest of the studies selected, although some demonstrated some plausibility for a relationship between posture and pain, there were several limitations in these studies, including poorly defined diagnostic criteria, wide sample variation, and poor statistical power. In conclusion, Dr. Rufus suggests that there is a large variance in normal posture among the general population, as well as a current lack of strong evidence to support an association between posture and shoulder pain. Okay, so based on best available evidence that we have today, we can safely say that posture is not a cause of pain. But why? Think of your own posture as something that you impose on yourself. You're choosing to place your body in certain positions when sitting or standing. And that's okay. As humans, we crave that position of comfort because, let's face it, we're lazy. But postural stress, however, is a little bit different. It's something that's imposed on you from your environment, and it's not effective to natural human movement. For example, your body ergonomics when sitting at a desk all day. So the regular demands that your body places on itself aren't enough to induce actual tissue damage, while our environment and other external sources may be. Our bodies are strong and resilient and really good at adapting to physical stress. The aptly named physical stress theory is a great example of this. It states that tissues like muscles, tendons, bone, etc. adapt to 3 different types of stresses over time. A high magnitude applied for a short duration, like a bone fracturing. A low magnitude applied for a long duration, like sitting in a certain position for an extended period of time. Or a medium magnitude applied repetitively, like you're using the shoulder over and over and developing a chronic rotator cuff tear. We'll focus on number 2 as this applies to posture. In 2002, an article in the Physical Therapy Journal was published on the premise of physical stress theory and the fundamental principles of tissue adaptation in response to movement, posture and alignment, motor control, and physical activity. Now, this is a really great read, especially if you're a healthcare practitioner. But for the sake of time in this video, let's summarize our point with this. Rather than emphasizing an ideal standard of posture and hypothesizing that there is a large relationship among specific postures, the physical stress theory proposes that pain is caused by excessive tissue stress and that postural deviations are only one of many potential variables that contribute. We commonly observe people with poor posture who are pain-free, and other people with good posture who have pain. These types of activities performed by people varies widely, resulting in different stress demands on tissues of the body. And let's face it, different people are different. Every single individual has a unique skeletal structure. Our organs, our muscles, all of our other body tissues are all unique as well. In fact, we're not even symmetrical in our own bodies side to side. So the asymmetries and the differences that you see amongst people really isn't all that unusual. In fact, it'd be a little bit weird if we all had the exact same body structure and shape and size. So if you're on the hunt for the perfect posture, keep looking, because there isn't one. Everybody's posture is unique to themselves, just like the tissues that make up our bodies. And in general, I think we should stop looking at posture as a static thing. Posture is dynamic, posture is always changing. And that may really be what correct posture is, always changing. If you sat in spine neutral all day, even that would get uncomfortable after a while. So what can you do if you're having pain and you think it's related to your posture? I would say number 1, move. Movement is so important. As we've discussed throughout this whole video, there's not really one posture that's bad or good, it's more of changing your postures throughout the day according to the task that you're performing. So varying your posture when doing a task, taking rest breaks, stretching, all of these things to break up the monotony of one certain position is more beneficial than labeling a posture as good or bad. Number 2 would be check your ergonomics, or the way that your workstation, or whatever environment you're working in, is laid out. While the way you sit or stand all day for your job may not inherently be a bad thing, your workstation setup could be. Straining your neck to fit your computer setup, having to reach too far or lean too far forward, all these things could be the true cause of your neck pain. And number 3, seek out the help of a physical therapist to learn how to move correctly. As we mentioned before, posture isn't static, it's a dynamic, changing thing. And with movement comes even more room for errors. So learning how to move correctly could be more impactful on your function in day-to-day life than learning how to sit a certain way. So don't worry so much about correct posture. Think of correct movement. Thanks for watching, everyone. I hope you enjoyed the video and learned something about posture related to pain. And as always, please subscribe to the channel and leave a comment below on anything else that you guys want to learn about.